Now, in these times of economic uncertainty, cost savings are high on the NHS agenda. One outsourcing company is providing bespoke solutions to GPs by delivering fast, effective returns and helping to improve the patient experience. Apodi's aim is to support doctors right there in their practices, working together to provide locally led services, as Simon Meadows now reports.
Healthcare is today facing unprecedented challenges. Financial constraints, an ageing population, lifestyle factors and the increasing expectations of patients. It's generally accepted innovation and partnership are critical to the NHS in these difficult times. And that's where organisations like Apodi come in. Apodi is a specialist outsourcing company working with medical practices and CCGs to improve patient value, defined as improved health outcomes per pound spent. It designs and delivers bespoke integrated care clinics and managed care programmes.
Probably a bit too much sun exposure over the summer.
In all of these, the GP remains at the centre of patient care, with Apodi enabling partnership working with secondary care and potential sponsorship from the pharmaceutical industry. As such, Apodi acts as a conduit between pharma companies and various parts of the NHS.
I think the key challenge that the NHS are facing is delivering better services for less financially. The pharmaceutical companies obviously have a challenge in trying to show the NHS what value looks like. So we're trying to work with both clients to kind of make those agendas meet, and we tend to be the glue in the middle really that brings that together.
This partnership allows medical teams to very efficiently triage, educate and treat patients. By bringing GPs, consultants and nurses together at the same time, they can receive best practice treatment in just hours.
Apodi has a team of network managers whose role is to work with CCGs to identify where they have patient cohorts that they might not have the necessary resource or capacity to deal with, and then identify sponsoring pharmaceutical companies or design programs or delivery mechanisms to make sure that those patients are better catered for.
An idea clinically may seem good, however, practically it may be difficult to deliver within an NHS system. Apodi bring in their expertise and have allowed us to integrate clinics like the psoriasis clinic within a primary care setting using secondary care clinical teams, and that's been to the advantage of both primary and secondary care and, more importantly, the patient. The patient spends approximately an hour in the clinic, and these are conditions where the patient wouldn't necessarily bother their GP about because they're chronic, and a lot of patients have become somewhat disillusioned with their disease or with bothering their GP about that particular disease.
Apodi works closely with LinkGov, which liaises with public sector bodies to strengthen interdependent partnerships across healthcare.
The Innovation Health and Wealth report by Sir David Nicholson, the sponsor for that particular report, highlights just how imperative innovation is. The report also makes clear that innovation is not gadgets and gizmos. It means decommissioning outdated ways of working and commissioning new ways of conducting strategic relationships with all stakeholders. The scale and pace of change that's taking place currently needs organisations who are able to move fluidly and rapidly with that rapidly evolving landscape. And Apodi have demonstrated that they're able to strategically align themselves to wherever clinical commissioning groups most require resources.
In these uncertain times, Apodi says it's important to be an outsourced partner that the NHS can trust, so improving patient outcomes. And that, it says, is its key measure of success.